together. And so I welcome any feedback or questions that you have along the way. So to give you context about who I am, and John touched on some of this, I was trained in human-computer interaction, and I was a software engineer before pursuing my PhD. Broadly, my research aims to develop sustainable systems and communities. I've thought about my research from the 3 sustainability pillars. My work related to environmental sustainability spans minimizing home energy consumption in low-income contexts, which was my dissertation research, and more recently, access to healthy food. Since joining U of M, most of my work has focused on economic sustainability. And I would say that an underlying thread among all of my work has been social sustainability. And social sustainability as it relates to equity, diversity, interconnectedness, and social cohesion. So if there's anyone who's working in this area, who's an expert in this area, I'd love to hear more about your research and possible collaborations in the future. So I invite you to please reach out. So in today's presentation, I'll share how the thread of my research, which focused on economic mobility and sustainability, led me to pursue community-based solutions to transportation challenges. So my research has investigated how technology supports employability in the domains of digital employment tools like the sharing economy, entrepreneurship, education, and transportation, particularly among minoritized and low-resource job seekers. I thank Professor Roderick Crooks at UC Irvine for his suggestion of the use of the term minoritized instead of underserved or underrepresented. So I'm following Gilborn's definition of minoritized, which refers to the exclusionary practices of more dominant groups and the racism that minority racial ethnic groups experience. So the expression minoritized in preference to minority reflects the ongoing social experience of marginalization, even when groups subject to racial ethnic discrimination achieve a numerical majority in the population. And today I'm going to focus my talk on ways that technological systems can alleviate and opportunities for technology to alleviate the transportation challenge that are faced by minoritized communities in health enhancing contexts like employment, but also access to healthcare and healthful foods. I'll spend most of the time today sharing these results with you. So we've employed various research methods in this work, including stakeholder interviews, participant onboarding to technologies like Uber and Shipt, case studies, and conducting online surveys. We're currently employing a community-based participatory research approach with stakeholders that involves participatory design and user-centered design techniques with plans to pilot our intervention in the next year or 2. And so I'd like to start my talks off with key themes and takeaways of our research in case people fall asleep or in case you need to step away or lose focus, especially in Zoom land. So I'd say the first key theme is that interpersonal transportation models where people give rides as favors or people pool together resources in a unique way appear to pose fewer barriers among other models of transportation. And when I say other models of transportation, I mean personal models. So if we're driving ourselves to work, or public models, if we have to take public transportation, the buses, for example, or even private forms of transportation like Uber and Lyft. A second theme in this work is that social sustainability, as it relates to the need for strong support networks and interpersonal connections, is also critical. And finally, intermediaries play a crucial role in addressing key transportation challenges found in this context. This also includes tech-related challenges, so people who might not feel comfortable using technology to call an Uber, for example. Also, these intermediaries help to buffer concerns around safety and also trust and reciprocity between drivers and riders. So to give you context, most of our research has been conducted in southeastern Michigan and primarily Metro Detroit. The city of Detroit is approximately 138 square miles and has a population of roughly 675,000 people. Detroit has been experiencing an economic decline for many years, in part due to the collapse of the auto industry. Almost 77% of the city is Black, roughly 11% white and 8% Hispanic, and 52% of the population identify as women, And then last demographic factor is the average age is 35. So in Detroit, there's a spatial mismatch in employment. In 2015, more than 100,000 Detroiters traveled each day to low-paying jobs in suburban communities. So reliable and affordable transportation is a necessity for work. However, the poverty rate of the area is approximately 30%, which is nearly 3 times that of the US, and the median family income is approximately $34,000 per year. I'm sorry, are you all able to see my screen? I'm noticing now that I don't see the highlight. Okay, thank you. So about 33% of Detroiters don't have cars, and those who do own vehicles spend up to 36% of their income on car insurance. Thus, individuals facing financial constraints are less likely to own cars, and if they own them, might do without driving them. So this limits their ability to access employment, healthcare appointments, and healthy food. So as Christoph Spieler wrote in a perspective piece in Urban Edge, transit agencies absolutely can be powerful tools for equity. A good transit network opens up a metropolitan area and its jobs and opportunities for all of its residents. At its best, transit includes everyone. So media outlets have outlined how these transportation challenges, including the lack of regional transit, are shaped by the racism embedded in the structures that govern the city's transportation system. Such injustices necessitate novel approaches to providing equitable transportation access, which motivates our work. So in this research, one of my overarching research questions has been, how might technology support community-based solutions to transportation challenges, particularly among minoritized groups? So as I mentioned earlier, this research question has been driven by my broader question to understand how technologies could better support minoritized job seekers or job seekers who experience marginalization to support their economic development and sustainability. And to answer this question, I first wanted to understand the strategies and barriers that people use to get ahead economically. We thought that technology could amplify and build upon individual and community strengths. So we found that strategies to getting ahead included having strong networks and access to education, whereas the barriers included limited access to strong networks and transportation. So I'll briefly discuss studies to onboard people to technologically driven transportation models like Uber and Shipt to address transportation barriers. So in the first study, to understand the feasibility of these models, we asked the following 2 research questions. First, how do these individuals describe their experiences using a real-time ride-sharing service as passengers? Second, what barriers do these individuals face in the onboarding process to use real-time ride-sharing services? We onboarded 13 participants to Uber Business and allocated $100 in Uber credits. I'll refer you to the paper for details, but we found that Uber offered more reliable access to transportation than buses and taxis, that job seekers connected with their drivers in interesting ways. So here we're starting to see this thread of social connection. We found, however, that Uber did not offer flexible modes of payments or non-digital access points. It also excluded potential riders who didn't have bank accounts or even smartphones. So in the second study, to understand the feasibility of an online grocery delivery model to provide healthy food access in our context, we asked 3 research questions. And as related to today's presentation, we're only going to focus on the first research question to understand if an online grocery delivery model worked to provide healthy food access. So in summary, we conducted a pilot study consisting of a controlled field experiment where we onboarded participants to Shipt, similar to what we did in our Uber study. Again, I'm not going to go into the details of the study. I'll refer you to the paper, but we found that the model worked in offering convenience, accessibility, service reliability, and food quality to participants. People also commented on the friendly shoppers. Again, we're seeing this social thread. However, it posed payment method incompatibility and in some cases limited social interaction. So our most senior participant said that grocery shopping supports the value of connection and at times friendship. As I mentioned earlier, this social sustainability thread shows up frequently, And I hope to study it in the future. But in this quote, Rachel said it best. When we were kids, shopping was an experience. I remember getting dressed up to go downtown, and kids now lose out on so much because, you know, you get together with your sisters or your friends and you go shopping and you have an experience. That's what's missing when you do online shopping. Sorry, I didn't have the quote. So to develop social-technical systems that could be successful in minoritized and low-resource contexts, I decided to revisit some of my past work to understand how people worked around their transportation challenges. I conducted this research in collaboration with my colleague, Professor Tiffany Vino, who also saw transportation access as a salient barrier to healthcare in her work. So we both revisited our data to understand how people worked around these barriers to health-enhancing resources. So I'll spend most of today's conversation sharing the results of this investigation. So before developing novel transportation models, it's critical to understand existing transportation models that are used, and again, understanding the barriers and the facilitators associated with them. So in our work, we sought to understand what transportation models do residents of minoritized and low-income communities use to access jobs, food, and healthcare. And again, these are job seekers facing economic hardships and people with chronic health conditions, most from racial and ethnically minoritized groups. Our second question asked what barriers and facilitators are encountered in use of each of these transportation models for these purposes. So to understand the existing transportation models used in the communities and the barriers and facilitators associated with them, we integrated analyses of findings from 4 empirical qualitative studies and 2 case studies that were conducted in Metro Detroit. These findings specifically address transportation-related access to health-enhancing resources. So again, employment, healthy food, and healthcare. 3 of the 4 empirical studies are related to employment and economic mobility. The 4th empirical study and our 2 case studies were related to healthy food and/or healthcare access. So in total, our work covers over 4 years worth of empirical studies across a total of 116 participants. So 3 empirical studies, DET1, so Detroit 1 through Detroit 3, were conducted to address employment and economic mobility issues in the city of Detroit. So 2 of these 3 studies I briefly mentioned earlier. So because transportation is a significant barrier to employment in Detroit, we reanalyzed the data for these studies. So Detroit 1 is the first study I mentioned. We focused on strategies and barriers to getting ahead. Detroit 2 focused on the feasibility of using sharing economy services broadly among low-income communities, and particularly for employment. Detroit 3 was a follow-up study involving onboarding participants to Uber to understand the feasibility of such services among Detroiters facing transportation challenges. So we've referred to the final empirical study as CHII, which stands for Enhancing the Community Health Information Infrastructure. This was a cross-sectional study in Flint, Inkster, and the northwestern region of Detroit. Participants were recruited through healthcare and service provider referrals and in-person visits to an exercise program for people with chronic disease. Participants were asked about their eating behavior and healthcare utilization, transportation modes for acquiring these resources, and their experiences with those transportation modes. Our first case study was Cart Rides, which at the time was a startup that partnered with a grocery chain located in Detroit to provide rides to individuals who lived within a 5-mile radius of the grocery store. So individuals paid $10 for a round trip ride to the grocery store using any preferred payment methods. So they were able to use cash, credit card, or check. And Cartride used what we refer to as a broker model of transportation. So it required that this organization, which I referred to earlier as an intermediary, Cartrides, to handle ride management and scheduling. And they did this through the real-time ride-sharing application Lyft as a partner. Prince Valley Market is a grocery store located in Southwest Detroit. And in September of 2015, the owner piloted a 7-month program to provide free rides home to shoppers living within a 5-mile radius of the store, and those shoppers who spent more than $50 on groceries. So whereas cart rides brokered rides through Lyft, Prince Valley Market brokered rides through Uber. So our analyses focused on finding patterns across all the empirical and case studies, using a common code book to answer the research questions that we were asking. So we initially developed the code book using the existing literature to identify transportation models and others not yet studied in low-income communities, like peer-to-peer ride sharing and shuttle services. We coded inductively and deductively to identify the 3 factors. So first, the travel purpose, second, facilitating or supporting conditions, and the third, barriers. So again, I'm going to refer you to our paper for details about the participants across the 4 qualitative studies, but the gist of it is that the majority of participants were African American and female. Minority of participants were employed, and in one of the studies, in at least one of the studies, in one of the studies, participants had at least one chronic disease. So I'm briefly going to discuss our results. So we categorize the transportation models used by our participants as personal forms of transportation, interpersonal, public, and private. Personal modes of transportation were widely used and included biking, driving, and walking. These forms provided the most flexibility, but were linked to barriers such as cost, and they depended on individual capabilities. For example, if I have a chronic disease, it might be difficult for me to walk or bike to the grocery store. Interpersonal forms of transportation were forms that we didn't find in prior transportation literature. These included favors and resource pooling, and they held the fewest barriers. Public transportation like paratransit and public buses were widely used, though participants noted that they were highly unreliable, especially for employment, and the service quality was low. Safety was also a concern for public transportation. Finally, private modes of transportation like brokers, taxis, real-time ride-sharing services, and jitneys, which are unregulated cabs, were used less frequently because they weren't always available, and they also held costs for the providers. So in addition to contributing empirical findings about the transportation models used in these areas, we also contributed a total of 9 barriers and facilitators associated with these models. So the most significant barriers and facilitators were affordability, service availability, and service reliability and quality. Our participants particularly described affordability issues around car ownership and taking taxis. So car ownership, for example, involves maintaining a vehicle, keeping it fueled, and keeping a vehicle insured. And at the time, it was challenging, given that Michigan had the highest auto insurance rates in the country. I checked, and the latest reports are showing that we're second now to Louisiana. So in terms of service availability, many models had requirements that limited their use. So this was especially important for transportation models like paratransit, which were only available for healthcare visits and were only available to seniors or those that had certain insurance types. So we also saw this with 2 transportation modes that were used least frequently, the broker model and the jitney model. Perhaps their limited availability was why they weren't used as frequently. We also saw that affordability of maintaining these models was a barrier. So this was a new finding because prior work didn't mention affordability from the perspective of the organizations. We also saw from the cart rides case study that digital literacy and trust in technology were barriers. These didn't show up in the Prince Valley Market case study because the store owner called the drivers directly. So there were other facilitators in these models though. Cash payments were accepted in jitneys, and cart rides accepted all payment types. Again, these were trusted organizations, and jitneys are trusted individuals for the most part. Is there a question? I'm sorry, I heard. Is there a clarification question? Feel free, I can actually see the chat window, so if there are any clarification questions, feel free to enter them in the chat. So the transportation was accessible in known places. So in these cases, transportation was accessible at a grocery store, at a local trusted grocery store. So, and finally, the service reliability and quality these were significant barriers. So participants described long wait times and lateness with paratransit and cabs. We found that driving, walking, public transit, and favors were used for all health enhancing activities that we were exploring. Personal forms of transportation were most preferred because they provided the most flexibility. But these interpersonal modes of transportation, especially favors, were really common, and these modes also posed the fewest barriers. So interpersonal care also facilitated upkeep sharing in the resource pooling model. So in one Flint example, we saw an informal arrangement between one of our car owning participants and a non-car owning friend. So this participant says that I can't afford gas. This lady I'm going to pick up, she's very good at, like, if some things break down, she'll fix it for me. She'll keep gas in the ride. She's been a good friend in my life, so I can do something. So if I can do something to help her, I don't mind. On the other hand, interpersonal reciprocity was a barrier to the interpersonal model favors. Our interviews revealed concerns about asking too much of others, which made participants reluctant to rely heavily on the favor model for inflexible needs like employment. Participants also felt that relying on favors conflicted with their desires for independence, and this prevented them from asking friends or family members for rides. So one of these individuals stated, I don't believe in asking anybody because when you ask, you always get let down. I learned to do things for myself. Nevertheless, the perceived limits could be expanded by reciprocating with other resources like babysitting or providing meals. Now I'm going to move on to the implications of our research. So the results of our study led us to contribute 3 policy principles, 3 design principles, and 4 transportation models. Due to time, I'll discuss a subset of these contributions, but again, encourage you to read the paper for details. So for the first policy principle, we say that reducing transportation costs through external funding and by leveraging current practices of favors and resource pooling. Ensure flexible eligibility and use criteria. So this has to do with, in some cases with paratransit, it's only available to certain insurance types, only available to seniors. Ensure reliable service and strict arrival times for some trips while allowing more flexibility for others. So for example, you can't be late to work, or you might not be able to be late to a healthcare appointment, but for picking up groceries, you might have a little bit more flexibility. So thinking through those things when providing multiple forms of transportation or transportation across multiple domains is something to consider. We also propose 4 transit models that build on these policy principles as well as our design guidelines. So we propose smart jitneys, expanded resource pooling, which is a generalized favor model, and transportation clubs. For the sake of time, I'll go into detail about the generalized favors and expanded resource pooling. But for the smart jitneys proposal, we were just suggesting that we could create technologies or ICTs, information communication technologies, for car owners who are seeking employment and who might be existing jitney drivers wishing to expand their customer base. So using technology to amplify the work that they're doing. And transportation clubs, which I won't go into detail about, really is helping people to form groups around walking or biking. And this is to address some of the safety concerns that came up. But we propose a generalized favor model and advocate information and communication technology support for those individuals who wish to or who already volunteer rides or exchange rides for other valued resources. For example, one individual may own a vehicle but not be able to drive it because they don't have a driver's license. She may be willing to allow a licensed community member to drive her to her medical appointment. In return, she may allow the driver to use the car for personal errands. So we believe that technologies could support the identification of community resources and those who are willing to assist others. Similar models have been suggested in HCI. We also suggest expanded resource pooling, which is an upkeep sharing model in which individuals in a community contribute to keeping a vehicle in working order. So along with the owner, those helping to keep up the vehicle could also use it. So there was only one participant who used this model explicitly, but we also saw vehicle sharing. In this model, people can contribute skills, work, and/or money to maintain a safe and reliable means of transportation for their community or as a part of a nonprofit. This could also work with both cars and bicycles. So to conclude, we describe the barriers and facilitators to transportation among minoritized and low-income individuals when seeking health-enhancing resources like employment, healthcare, and healthy food. We identified a set of policy and design recommendations and proposed 4 new transportation models that build on these implications and that we strongly believe could support our communities. From this work, we propose that future interventions focus on socio-technical integration with communities' current capabilities, resources, and involved actors. So building on these learnings, I conclude with our current work where we're looking to implement socio-technical and community-based models to address these transportation challenges. Our study investigates the potential for using time banks and interventions to address transportation barriers like employment, access to healthcare, and healthy foods. So I'm going to discuss our work in partnership with a Detroit-based time bank and a federally qualified healthcare center. Our goal is to partner with known intermediaries that could help to address some of the trust and reciprocity related concerns from our earlier research. So what are time banks? Time banks are community-based, non-specific voluntary services that encourage exchange of services for time dollars rather than money. We specifically believe that time banks could address reciprocity-related challenges that we found earlier. So as you see in the diagram, Gloria joins a time bank and lists the skills she has and the things that she needs. Gloria helps Ron with his grocery shopping, and she earns 2 hours as credits for this task. Gloria then spends her hour credits having Jasmine drive her to a job interview. And then this cycle continues. So in this work, we asked the 2 research questions. How can shared mobility systems in the context of a time bank be designed to promote trust and reciprocity between drivers and ride recipients in minoritized and lower resource communities? What are the potential roles of intermediaries for supporting trust and reciprocity? So what are federally qualified healthcare centers? These are community-based healthcare providers that receive funds from the Health Resources and Services Administration Health Center Program to provide primary care services in lower resource areas. So FQHCs have to meet a stringent set of requirements, including providing care on a sliding fee scale based on ability to pay, and also operating under a governing board that includes patients. So we held a series of online workshop sessions from November 2020 to May 2021 with Detroiters who were recruited by either our local time bank or the FQHC. Again, our partnership with the FQHC allowed us to address the research questions in the context of transportation access to healthcare appointments. So to participate for the study, we asked participants to complete activity packets before taking part in a virtual 2-hour Zoom workshop session. We designed the activity packets and virtual workshops to complement one another. We also asked participants to return these completed packets to our research team through email or through SMS. They also had the option to return them to the time bank or the FQHC. Our intermediaries, our community partners helped us to recruit drivers. So our drivers were people who provided rides to others in the past. And then riders, these are people who received rides from others. So here's an example of what these activity packets look like. We constructed 2 activity packets for participants. One packet was aimed at potential riders, and the other packet was aimed at potential drivers or people who had driven in the past. Packet goals were to begin to stimulate participant reflection on issues that were related to trust and reciprocity. For example, in terms of reciprocity, we asked, what 3 things besides money might you give Ronnie to compensate for the ride? So this is Ronnie. Or what services might you be able to provide in exchange for a ride? For trust, we asked questions like what concerns might he have getting a ride from a stranger? So the packets also contain study details like where to return the packets or send images to text to, as well as details about the Zoom session. So we as facilitators walk through each question, asking participants to expand on their activity packet responses. Facilitators also sought to elicit comments from participants on others' responses in addition to their own. By the sixth session, we had reached data saturation such that no new empirical findings related to the research questions had emerged. And we recorded all sessions. We recorded and transcribed all sessions, which were later verified by research assistants. So our data included the packet responses, the session transcriptions, and we also had demographic surveys. Our data analyses focused primarily on a descriptive analysis of demographic data, content analysis of participant packet responses, and thematic analysis of transcribed sessions. So to increase validity, these two data sources were used as a form of methodological triangulation to clarify ambiguous answers to packet questions and also to compare findings garnered using the two methods. So we found that promoting trust between drivers and riders requires that shared mobility systems address safety and reliability concerns. So as you can see from our findings, safety and reliability concerns were the most salient. In terms of safety, there were crime risks, driver safety and skill, and with COVID-19, health risks. In terms of reliability related concerns, there are risks of missing or being late for appointments and risks of vehicle malfunction. So this quote from P18 in our fourth workshop session shows the safety concerns, particularly among older adults. When asked about her idea of a safe driver, she said, "Is someone that I can feel sure won't try to exploit whatever knowledge they learn about me as they pick me up and take me riding. They would know where I live, my circumstances, that I'm a senior person who may have some medical issues, who may be frail or may be weak. There's a possibility that you see me as a person to prey upon." We also saw through time bank members that trust was made possible by the formation of dense social networks that last over time. Participants from both the time bank and the FQHC expressed strong commitments to designing a shared mobility service that expressed relational values over transactional ones. So transactional exchanges are typically short-term and are described by monetary exchanges for an easily measured commodity. These exchanges can be adversarial because stakeholders must grapple with what's needed to achieve the best position economically. By contrast, relational exchanges are longer term and value relationships and are characterized by factors including cooperation, interdependence, commitment, trust, and shared values. Reciprocity-related tensions could be reduced by interpersonal relationship development and expressing appreciation. So in response to a query about how the gas money or vehicle upkeep should be handled, a time bank driver emphasized values of building community over the specifics of reimbursement for those expenses. So participant 9 from workshop 2 says in the quote, "They also want to feel that they appreciate the ride." And I think that plays into giving some token of appreciation too. I don't know if it has to be transactional as much as it's like fellowship and just friendship and developing that relationship with people. We learned from our sessions how simple thank yous, virtual hugs, or even fist bumps might be appreciated as an alternative form of payment. Our findings suggest methods to balance reciprocity. On one hand, all time bank hours are equal, and some participants felt firm in these principles. On the other hand, rides use gas and led to wear and tear on vehicles that can't be fully accounted with time dollars. They felt that the time bank should help manage the vehicle wear and tear costs and maintain a library of equipment that might accommodate a ride, like car seats. We believe that technology could be used to book equipment and identify drivers whose level of transportation service provision warrants compensation beyond time dollars. In addition, systems could build on opportunities for reciprocal exchange beyond monetary transactions, such as what we see here. This would help to encourage exchanges that people might not have previously considered, which past research suggests. So as we see on the table, teaching, mentorship, and skill exchange, home services and repair, and other services like volunteering space or lending money were services mentioned by our participants as things that they could offer. To answer our last research question, we found that intermediaries must facilitate safety, reliability, reciprocity, and potential issues related to digital access and proficiency. As we saw earlier, trust between riders and drivers was supported by building dense networks that persisted over time, which we saw in our time bank members. Time banking allows for a history of service exchanges, which was needed for people to feel comfortable sharing rides. And so our findings uncovered discrepancies between the two intermediaries' abilities to moderate these trust-related factors. Specifically, historical exchanges that are inherent within time banks better foster trust than non-time bank intermediaries who lack similar traces of historical exchange or similar opportunities to form relationships. However, both types of intermediaries were seen to hold potential for further supporting trust based on certifications. So in other words, if either of the two could certify drivers and vouch for riders, that would help to buffer these trust concerns. So our participants indicated that certifications could come from different types of intermediaries. So mechanics could vouch for someone's vehicle condition, or insurance companies for their insurance, or even the state government could vouch that someone had a valid driver's license. So here are some proposed designs from our work that we plan to get feedback on going forward. For instance, there was tension around whether background checks were necessary, and if so, how detailed the background check needed to be. So these are all questions that we plan to explore going forward. Our next steps include holding participatory design sessions with both old and new participants to build out our recommendations and proposed designs. We're working with our intermediaries to understand the feasibility of facilitating things like banking credits for vehicle wear and tear, or certifying and or vouching drivers and riders. We're planning to pilot our proposed system in collaboration with our intermediaries. So one limitation of this work was that it took place primarily in an urban setting among low-income populations, which is a vulnerable group. In collaboration with Indiana University, we've also been investigating what our results might look like in a rural settings among another vulnerable group where transportation is also critical. So in this work, we focused on transportation access among people living with HIV. And the findings of this study mirror our earlier findings. So while driving was the preferred method if people had access to a vehicle, people received rides from family and close friends as a second alternative. We called it was a form of light reciprocity or neighborly altruism. They used public transportation when available and avoided taxi, Lyft, or Uber services because these were either too expensive or unavailable. We also saw that case coordinators, which was another intermediary, were the last line of defense and provided door-to-door rides to HIV specialized care. They also help with coordination with clients' social circles. So again, we believe that our generalized favor model might be a suitable alternative even in the rural context. So we're interested in whether the time banking model can provide this type of support. Again, technology would be supporting individuals wishing to volunteer rides or exchange rides for other valued resources. So to recap, transportation as a barrier to health enhancing resources like employment drove me to this work. I've investigated transportation driven models or technology enhanced models like Uber and Shipt as models to address transportation barriers. And I found that such models can be convenient and reliable, and that social interactions were a key factor in both. Whether it was exposure to positive social interactions as seen by our Uber participants or job seekers who were losing out on interactions, or as we saw among our Shipt participants. We also uncovered issues related to affordability and inflexible payment models as barriers. So the need for credit cards or bank accounts. And also in our Shipt study, we found that the grocery stores didn't accept EBT payments. So we've explored facilitators and barriers to transportation and found that interpersonal transportation modes pose fewer barriers. Again, social sustainability is a key theme as it relates to the need for strong support networks and interpersonal connections. Facilitating reciprocity and existing trusting and caring relationships will be necessary for future tech systems to support safe, reliable, and affordable community-based transportation. Prioritizing safety and reliability is also key to fostering trust. So finally, the role of intermediaries was critical to fostering trust between drivers and riders, and intermediaries might buffer technical challenges identified in earlier work. So we turn to time banking and the connections among time bank members as a starting point to promoting relational over transactional interactions and propose social technical design recommendations to facilitate these interactions. So I'd like to end my presentation here and take your questions. But before I do, I'd like to thank my research team, colleagues and collaborators, community partners, and of course, our funders, National Science Foundation, University of Michigan, and the Institute of Museum and Library Services. So I'm going to leave off with these key themes and takeaways, and also pose a few questions for you. So thank you for your attention.
Great. Thank you so much. That was an amazing presentation, and I think you left us with all a lot to chew on. And hopefully we'll have a really great discussion about that now. So at this point, we are going to open for Q&A for Dr. Dillahunt. You all are welcome to either add your questions to the chat box. You can also use the hand raise emoji to kind of get on the question list. I'm going to use my moderator privileges to kick us off with the first question, however. So I have a few questions. The first thing I wanted to go back to is something that you actually didn't touch on very much. One of your, I guess one of the proposed recommendations was this idea of kind of this smart jitney proposal. And I was wondering if you could elaborate on that a little bit, because I'm kind of curious kind of how that proposal is distinguished from example saying, okay, well, an existing jitney driver is suggesting they go and drive for Uber or Lyft or something like that. How is that proposal different?
Yeah, so I think, I mean, I'm sure you all are aware, like the Uber and Lyft, how drivers aren't really compensated as much as they should be compensated for. Also, the jitney drivers will accept multiple forms of payment. In fact, I don't think they take credit cards. I think they're like cash only services. So our proposal was just promoting the services that they provide. For now, and we only know this from the perspective of the grocery stores who we work with, not actually with the jitney drivers, but the grocery stores have, they know they're jitney drivers, they're part of the community. And so they'll call them up and, to provide rides. But we believe that they could be providing a larger service given the needs that we've seen in our work. And we were trying to understand ways in which technology could facilitate that, right? It could just be a management here, here are people you could connect to. So I think that is the biggest difference is how payments are accepted. And then also not the overhead costs, not the significant overhead costs. Again, we're thinking about community-driven models.
Got it.
Mm-hmm.
Okay, thank you very much. Would anyone else like to take the next question?
Or you can maybe answer some of the questions I've posed. It looks like Eric has a question. Eric, it's so great to see you.
Hey, long time no see.
Yeah.
Tawanna, I wanted to just ask like a broad, maybe like a stepping back question, in the sense that like when I'm an HCI person, you're an HCI person. And when I think about even the title of this talk, and thinking about, community-driven approaches to transportation systems, when you think about like transportation systems, they are so huge and complex and layered, like as an infrastructure. So it seems that both from a researcher side and also from a community side, it might seem sort of daunting to be thinking about how these sort of infrastructures can be community centered. It seems, impossible or very difficult. And even then, so there's on that side, and on the other side, I think, especially for the people here at CUSP, we generally, as a research center, we tend to be very, technology first, and then, community second. So if maybe you can step back and, walk us through how we can, how can we think about essentially creating these entry points for community-centered approaches to these large infrastructures. Because off the top of your head, you're like, well, how the hell do you even do that, right? Why would I do that? You know, just from like a philosophical standpoint.
Yeah, I mean, I agree that it is huge. But what we do at huge, well, at least what I was trained to do at huge problems at engineering is kind of break them up into smaller chunks. And so we're really focused on we're focused on the margins, right? Who's being left behind by the existing structures? I'm not saying all transportation is bad. I'm sure it's working for some, but it's not working at all for for the populations we've been working with. So we're really just focusing, on them for now, right? And as an HCI researcher, I'm sure you know this, is when you focus on the populations who are experiencing the most marginalization, sometimes you create a better system, a larger system, right? These are things that could be used by by everyone and used in a better way. So I think that's how I'm thinking about the scale, like how big of a problem it is. We're trying to focus. I think your second question was about entry points. Again, like intermediaries play a huge role in facilitating trust or fostering trust, or in shepherding people in learning how to use these new technologies, right? How to, how to, some people, don't feel comfortable using Uber or calling a ride service on a phone. Like they want to talk to somebody. Intermediaries play that role. So as entry points, we've been looking at them as stakeholders to work with, and also to reach out to potential riders and drivers. Thanks for your question. Charalampos, is that how you pronounce your name?
That's a great, it's Haralampos.
Oh my God, Haralampos. Thank you. So sorry.
No. That was
Okay.
that was a great. That was thank
Great
you for
attempt.
attempting that. That's a brave step. So one question I have is whether you can see this kind of framework scaling to other services. For example, I did my PhD in Baltimore, and we could see that one of the problems was food access, and that in certain neighborhoods, and that was the solution, not through technological driven a technological driven way that you showed, but there were informally certain people that would go to the grocery stores, buy and get them back. Now, I was wondering if this can also can scale and address other access to other services, for example, healthcare, to the extent that transportation is a problem, even the internet in certain neighborhoods, even that is a problem. So what are your thoughts on this? Thank you. Thank you so much for the very interesting presentation.
Thank you. Thank you so much for your question. So, in our work, our investigations have been covering the context of, employment, food access, and healthcare access. So we do believe, at least in our context, that it would work. But I also have another project with Notre Dame, thinking about these food access and food delivery hubs. And I think the question there, specifically around food, has to do with access to healthy food, right? Like, well, I will say non-perishable, or perishables versus non-perishables, right? And so there are some key challenges there, and we've been thinking about, well, will the intermediaries have refrigeration equipment, right? Or, in the case of Detroit, like a lot of the schools, like during COVID, a lot of the schools kind of played that role of an intermediary or the hub where people could come to, but the people who weren't able to access that, how do we connect, right? So I mean, we're still thinking through that. And I don't think our particular case, what I presented today, covers that case. So I don't think at this point it's going to work perfectly. But I do think it will likely work better than what we've been seeing. Like it'll definitely improve what we've seen so far. But that's a great question. Thank you. And you know, I think I had a question about what about in the case of food delivery? You know, who are the intermediaries that we might be missing? And so that is a question. I mean, I think rec centers has come up in my investigations, schools. So we're still thinking through that. Yeah. It looks like Graham has a question.
Yeah, hi, thank you. Super interesting talk, super nice longitudinal work that I think kind of it makes it really special. So I guess my question is, you were touching into a lot of areas of informal economy.
Yes.
And I wonder about the challenges of raising the profile of the informal economy. I mean, there are often reasons why it's an informal cash-based economy. So maybe talk to some of those challenges and how you can overcome them.
So yeah, I mean, I think that's a broader question that I have around informal economies and how to bolster those in the community. I mean, I think the challenges that we're seeing with the time banking, I think there are some federal challenges related to like time banking. These are hours, right? No one's taxed on hours. But when you're talking about compensating someone for wear and tear on their vehicle or gas money, then that's kind of a tax. That's it, you know, that's income, right? And so those are challenges I think that we're seeing in the time bank. You know, another project that is completely separate from this one, and it goes back to the earlier question about internet not even being available in some communities. And, you know, one project that we're piloting right now, we're calling it a Community Tech Workers Project, which is modeled after the Community Health Workers program. So community health workers are lay people in the community who help their community members navigate the healthcare system. So what we're trying to create is a community tech workers model where we're paying people to train on technology so that they can be the intermediaries in their communities to answer questions related, you know, to technology, or, you know, can you order a Lyft for me, or can you order an Uber for me? Can you manage these things? And so in a way, we're trying to create our own informal economies, or trying to understand how to, like, what would that look like for our specific community? Because you're right, like there are sharing economy models that exist, you know, there is time banking models, but we're really trying to understand what works best for our communities. What does that look like? We also have work where we're imagining alternative digital economies and creating methods and approaches. This is collaboration with Professor Christina Harrington at Carnegie Mellon, but a lot, you know, creating a space in which people can imagine what this looks like, because I don't think it's out there. I don't think we know yet, and how can that be supported through technology? Does that answer your question, Graham?
Kind of. It actually answers a better question than I asked, so thank you. Yeah,
okay.
The question was kind of particularly, I guess, focused on the cash aspects of the economy, and how whether that causes problems in your research when you're raising things that people may not necessarily want raised, and how you kind of traverse those challenges.
Right. Yeah. Yeah. The time banking one is definitely a challenge with cash. Yeah. I think those, I mean, even with the jitney drivers, I mean, I think we want to kind of remain agnostic of the transaction. As a technologist, you manage it the way it, you know, works best for you, kind of stay out of those fires. But I don't think we've gotten into that level of detail yet. So we're still working on it.
Cool. Thank you.
Yeah. John, I see you have your hand raised.
Yeah, and I recognize we're right at time.
Right.
So if you have the time and want to answer, you're welcome.
Yeah, sure.
You know, so I'll give a comment and a question. My comment briefly, I was really interested in thinking about this idea of expansion that Carlampos kind of mentioned. And I think a lot from a healthcare perspective, we've been hearing about how so many people are using Ubers and Lyfts as opposed to to ambulances, right? Because of the cost of ambulance rides. And so they're, you know, for better or worse, kind of using Ubers as a replacement for that, and how just thinking about that in the barriers you mentioned for certain folks where, you know, whether it's the inflexible payment method really creates a barrier. So that's just something kind of thinking about broadly. But my question is about this time bank, because it's not something that I've been exposed to. I'm fascinated about them, and I'm really fascinated about kind of the broader kind of implications of them. But I'm also imagine maybe someone like Graham was suggesting, there could be some pretty strong political backlash to further advancing, especially in kind of a capitalist system, maybe not being so much of a fan of these, because kind of, you know, really pointing money to be the middleman in a lot of regards. I was wondering if, in your experience and kind of knowledge of time banks, kind of what the political, you know, will around that methodology is.
I have to acknowledge that I you know, time banks have been around for a very long time, and I think those are the challenges related to them. Again, you know, in terms of being taxed, right? Like just being very careful about not exchanging money and only exchanging time. So a lot of the time bank members who've been members for forever are very strict. No, you know, an hour is an hour. And then others are like, well, you know, wear and tear, there would be you know, a nice way to handle that. And so in creating like a library or an inventory of things like car seats, or I don't know how others could be, you know, compensated. I don't know if dollars, you know, are enough, but I think we're still working through those. I think I think there's room for them to play a larger role than what they have. The research says that they're used primarily, I think, by older white women, well-educated. So specific group uses them. We're trying to understand, you know, what is the opportunity to use this model in our context. So I think there's more work to do there. I need to understand the political ramifications for more, but I'd be happy to talk to you more about that and how my approach to thinking through those problems, potential problems. Yeah.
Great. Well, yeah, I want to say thank you once again. Really appreciate your talk and chatting with us, and invite everyone else to send your virtual round of applause for Dr. Dillahunt. And thank you all for coming.
Yeah, thanks so much. Please reach out if you have any additional questions or if you're interested in collaborating. All right.
Great.
Thank you.
Well,
bye. Bye, Eric.